In urban areas of Arizona, there are about 80 primary care physicians per 100,000 population. In some of the small rural towns in Arizona, that figure drops to 10 primary care physicians per 100,000.
The University of Arizona has really been a thought leader on how you prepare students for community-based practice. The Primary Care Physician Scholarship Program is part of a larger effort to really address some of the health workforce shortages in the state. We want to align the scholarship program with individuals that grew up in rural and urban underserved areas and then plan on going into practice in those areas.
There are definitely people throughout Arizona who have considered medicine because they want to come back to their communities to serve, but they don't know how they're going to pay for it.
The scholarship will encourage some students to make that commitment by providing them some debt relief.
Every year that we accrue more and more debt, it's very, very scary.
This is a really important program so that students are free to pursue their interest in primary care education and residency without having the anxiety of worrying about a debt burden that they can't pay off when they finish.
Having an opportunity like this where it takes away that financial burden, it really allows me to focus on what I want to do instead of picking what I want to do based upon what's going to pay me the most.
To be able to reduce that burden, for them to take away that stress, we believe it allows them to most efficiently make a decision that's best for them, that they can follow their heart, and they're able to serve who they truly want to serve.
I feel like growing up in Phoenix, I was able to witness firsthand the healthcare disparities that exist and the needs of the community that are not met. And so to be able to commit to serving in Arizona is very exciting because this is a passion of mine and this is why I entered medicine.
The fact that I get to go home, back to the area where I'm from, and serve the people who I grew up with is amazing. And the fact that my school's being paid for so I can do that just is like an added cherry on top.
This was my path to medicine, and it might seem crazy and it might seem like it's not attainable, but you gave a girl from a really small town amazing opportunity and an opportunity to serve her community.
Being able to stay in Arizona where my children were born, where I was married, where my husband's family is from, that I will be able to give something back to the state that has given me so much.